me to the hospital, admit to the hospital in timely manner, and fever was the most important symptoms, but less in the elderly. So the next step, when we find out the research evidence, we start to consider that can we use the simple devices to continuously monitor people at risk of adverse consequence. For example, for the elderly, if they don't have a fever at the beginning, can we monitor them in the community? So how can we monitor them? Can we give them a simple devices or some IoT devices for them to to prevent and control their infections. So that's a practical issue we need to start to thinking about that. So here. According to our previous study findings, we found out that abnormal body temperature pattern are informative for people at risk of infection and or a risk of poor prognosis. But now, currently we use thermometer such as the electric thermometer or infrared ear thermometer to measure the human body temperature at an interval or only when a patient had a condition change, which means we only check your body temperature when you have a fever, when you have a risk for fever. Therefore, we may not detect abnormal change timely. However, the measurement tool for continuous monitoring body temperature, such as in clinical practice at that time, are usually invasive and may not be applicable in general population. We cannot give them the tool for them to use in the community because it is invasive. So we start to think about that, how can we develop a simple devices to continuous monitoring body surface temperature. So body surface temperature is quite different from core temperature. Maybe you can know the ear temperature or forehand temperature. So we start to develop a wearable devices. There were many devices were developed to continuous monitoring body surface temperature, especially during a COVID-19 epidemic. But many of them with the limitation that of low feasibility or less clinical validation, or only limited in pilot study or prototype stage. So that's why we start to develop this wearable device. We call it heart thermal. Heart thermal can be used to continuous measure their body temperature, heart rate, calorie, and steps. So we can use the heart thermal, this kind of wearable devices, to wear the wrist surface temperature, and in real time, we can measure the wrist surface temperature every 10 seconds to continuous to check the variation of body surface temperature. But we also went to the CES show in 2019. CES is the biggest commercial show, commercial technology show in the world. It has served as a providing ground for innovators and breakthrough technology for almost 50 years. So the global stage provide us opportunity to show the novel technology and the wearable device for introduced to the marketplace. So we have been there. And when we use the wearable device to continuously monitor the body skin temperature, you can see the blue line. It shows the signal here is very complete here. Can you see? So, however, according to this figure, you still can find that there is a similar patterns between the skin temperature and the cold temperature when people is sick. Therefore, we will work with the expert from computer science and mathematics to develop the AI model, which means the AI algorithm to identify the abnormal high temperatures. Here you can see this is a real case. The blue line indicate the variation of skin temperature, and there is a black circle here. It means the core body temperature we measure in the clinical practice, and the red icon means the warning sign detected by the AI algorithm. So our AI algorithm can continuously detect the variation of body surface temperature to early predict fever risk. The sensitivity and the specificity is very high, which means when people receive notification that truly had a fever at that day, and people who did not receive the notification from the systems that did not have a fever at that day. So you can, according to this fever, you can see like when people before the 10 hours before people had a fever, we can detect and warning their manager. I mean, warning their the first line healthcare provider to notify them people who may have a risk for fever. And with we can detect the fever and show the notification to the manager, but not only to the manager, but also to the individual, the users. So when we have a device and we also have the AI algorithm, we need to make it real. We started to cooperate with industry university cooperation. We work with a software company and keep working with interdisciplinary team. You can see that there are many professors from different specialty, like for computer science and nursing and mathematical and medical infectious disease. And we also have the engineer from the software company and the other operation manager. And we make the whole we have developed a complete system which called Care AI AIoT system. We developed different wearable devices, and they can connect it through by they can connect it by the Bluetooth to the gateway. Here is the gateway, and we can the data can transmit through the gateway to the cloud. And in the cloud, we have the AI algorithm to early identify people who are at risk for fever. And the last step is we develop the manager dashboard. We can, the first line healthcare provider can receive the notification through manager dashboard and the app. We also developed the app to connect the IoT devices and continuous monitoring physiological indicators. So here shows the app. You can see your variation of physical indicators by using this app. And we also developed the manager dashboard to provide real-time risk assessment. Here shows the real case. You can see that because the patient had many fever at that time, so the warning signs still keep going to keep running notification for healthcare providers. And we use the whole systems in the real world. The application of AIoT in various medical fields. The first one is we use the AIoT system in home living. When you living in the community, we can continuously monitor your physiological indicators, the vital signs, including heart rate, body surface temperature, saturation, and your steps. And moreover, we also use the AIoT system in palliative care because we have many cases in the community. For the case manager, they want some innovative system to remote monitor the conditions of the patients. So we not only use the AIoT system in the hospital, but also in the palliative care and the long-term care. I will show you some cases related to the long-term care and palliative care. The first scenario, we use application list continuous temperature monitor system among healthcare workers during COVID-19 pandemic. We use these systems in National Cheng Kung University Hospital. And we received the Smart Health Award. For COVID-19 patients, although they don't have a fever at the beginning, but fever still is the important symptom for increasing the efficiency of screening area, confronted with a shortage of healthcare resources during COVID-19 outbreaks. So we still can screen their body temperature if present. In Taiwan, I don't know whether it is similar in Indonesia. In Taiwan, it is recommended that the first-line healthcare providers need to measure their body temperature every 8 hours before they go to work, and after they go to work, they need to measure their body temperature and record to type in the medical record. And however, the clinical application of the frequently measuring their body temperature over a long period is difficult due to its high dependence on healthcare provider motivation and the high possibility of human error, especially during the busy epidemic outbreaks. So how can we use AIoT solution to protect our first-line medical care providers? Here is the video shows we use the AIoT in the medical health care providers. Sorry, the video is made in Mandarin, but you can see the screen. They will use the wearable device before they go to work and to connect their informations. Oh, fine. So we use the wearable device to continuously measure the healthcare provider's body temperature. Once they have a risk for fever or discomfort, the notification will automatically send to their manager or send to the medical staff. Here you can see that because before application of AIoT system in healthcare in hospital, they need to self-monitoring ear temperature during to work and off work. And when we start to use the heart thermal and set up the gateway, the data can be transmitted by the gateway to the cloud, and we can do the AI algorithm analysis to send the notification to the manager or to the users. So we can do the continuous monitoring body temperature and real-time location monitoring to reduce the transmission risk, infection risk. So you can see that before we use the AIoT system in hospital, the adherence rate for measuring body temperature in healthcare provider is about 77%. But after we application of the AIoT system to continuous healthcare providers' body temperature, the adherence rate increased to 85%. And here shows the contact tracking. When someone is infected, we need to do the epidemic survey to identify the past trajectory of the infected people. Before application this care AI system, we need to spend a lot of time to survey, and moreover, it might be not complete or incorrect due to the recall bias. For example, do you remember where did you go or who you met yesterday? I think many of you cannot remember that, right? So it also happened to the medical staff in the hospital. So we use the AIoT solution. After application of the AIoT system, the epidemic survey period is efficiently shortened to be less than 1 second. So you can see that at the beginning, we need to spend about 2 hours to find out the trajectory, the activity path of the infected staff. But now we only use we can automatically to check them and to the time reduced into less than 1 second. So here shows visualize the healthcare providers activity path. And you can see that here is the nursing station, which is there is the most people here together here to communicate and to work together. And here is the word. So the findings and the evidence when we use the AIoT in prevention of infection in healthcare providers. In Taiwan, the news report for our team AIoT solutions in COVID-19 had been published in different news and reports. And we also publish our study findings and the efficiency of the AIoT solutions in top journal in medical informatics. If you are curious about the AIoT solution, actually we are working with Dr. in Indonesia hospital now. Maybe you can ask him for further suggestion or comment. And here, because we use the AIoT solution to protect our first-line healthcare providers, the government give us the award to say to the honor for us. And okay, so we further thinking about, because we already applied this IoT system in medical field, so we further think about that, consider that can we use the similar system in prevention of infection in long-term care, because there are some care challenges in long-term care. In a previous study shows that 8 out of 10 COVID-19 deaths in United States among is older than 65 years old, and 40% of land deaths linked to the long-term care facility for older adults. So it is important to protect our geriatric patients, geriatric people, elderly in the long-term care. There were many sad stories happen during COVID-19 epidemic. We may not be together with our family and cannot go to the long-term care facilities to see our grandparents. So we as a nurse, we need to provide a safe environment for the elderly. So we use the AIoT system in long-term care institution during COVID-19. You can see that we set up the elderly use the wearable devices, and the data will transmit through by the gateway. And once the elderly had a risk for fever, the care manager can receive the notification real time and take action with the elderly. We also, because the physiological indicator is quite different between the younger patient and the old elderly. So we also developed another AI algorithm for the elderly. You can see that the AI model performance in long-term care is quite high, because during 4 months there is no older adult had a fever, so the sensitivity is quite high. The specificity is also high, and we also use the AI system in smart quality center, which we want to triage the people at risk for severe symptoms. And you can see like here, we apply the different wearable devices in the quarantine center, and the manager can receive the notification through dashboard or app. Once the people had severe symptoms, they will send to the medical center. So here shows the real-time. Okay. Here shows the real-time remote monitoring and confirmation of severe cases through AI model. We learn them to use the wearable devices, and including the body temperature, heart rate, and the saturation. Once they have the risk for severe symptoms, they will immediately send to the medical center for further treatment. And in the hospital, there is a dashboard to monitor different patients in the quarantine center, so they can see the whole situation in the quarantine center and the variation of each patient in the centers. We also developed the Lightbot because in Taiwan we use the Line app is the key messenger to communicate with each other. So we developed the Lightbot to assess their severity of disease in COVID-19 patients. Here you can see the can you see here? People can add the Lightbot into their good friends and type in their ID and password. We will ask them many questions to assess their severity. Okay. So you can see that the medical staff can receive the warning sign through by Lightbot, so they can early detect the abnormal conditions in COVID-19 patient. Okay, so now we start to use the AIoT system in estimating the life expectancy of dying patient. We use the technology in assisting the healthcare case manager to monitor and manage their case in the community. Because in Taiwan, both nurse and family worry for 24 hours a day to worry about the less than, I mean, the end of the life, the time of the end of the life. So we want to use the non-invasive continuous monitoring devices to monitor the vital signs, keeping an eye on the patient condition at any time, including their heart rate, body temperature, saturation, and respiratory rate. So here shows the similar system components, but I want to emphasize that nurses are the key role. Although we use the similar system in application in different situations, different medical scenario, the service process design that meets care needs. Only nurse and only the first line healthcare provider know the really care needs in the practical. So we use a wearable device, and for example, in dying patient, we need to focus on saturation and the decrease of body temperature and heart rate. But for the patient with infection, we need to focus on increased pattern of the physiological indicators. So different situation, different usage scenario, we need to develop different AI models and the service process. Here shows the real case here, and because we can use the IoT devices to continuously monitor the physiological signs of the dying patient and remote to monitor them. So the case manager can see the variation of vital sign in real time, and when that started to the condition of patients start to change, we can send a notification to the case manager, and the case manager will go to the patient's home and to see the condition of the patients. And after we already use the system in the case manager palliative care in community, and we can early detect the last mile of the patient 1 day before. So the case manager, not only the case manager, but also the family will feel more comfortable because they don't need to worry about that, because they are worried about that once their family going to have is near the life expectancy is quite few. They are afraid that they cannot get together with him. So the AIoT system help them to remote monitor their lovely family members, and to let them to have time to get together and to say goodbye. So we're still working and keep learning with different disciplinary experts. And though you can see the component of the AIoT system is quite simple, but the process of development and application is quite complex. So we work with different teams. Here shows the team member. We have the IT member from computer science, and the medical members from nursing and public health. And we still keep working. We keep working with different projects. For example, today, this morning, I just met with Google, and we want to use the AIoT system to try to early identification people who are at risk for severe symptoms. We also discuss with our local government to further suggestion in prevention and control of COVID-19. And now we are working in the international cooperation work with Dr. Iqbal in Indonesia hospital. We want to apply the simple idea and the AIoT systems and this model into different medical fields and different countries. And thinking about that, how to define your own future of nursing. I have some suggestions for you. Study, work hard, but remember that you need to keep learning and pray hard. Okay, my presentation will be end here. Thank you very much for being here to listen. If you have any question, please feel free to contact me or to ask me. Thank you.
Okay, thank you very much, Dr. Ye. Wow, it's wonderful, amazing. So yeah, we have seen what have you done, that you have worked a lot in this thing about AIoT. Okay, yes, I remember I saw about I think our collaboration is still running, right? So let's see what's gonna happen in the future about this collaboration, and perhaps this collaboration will be keep I mean will be keep I mean, not only this time. We hope that in the future we will do another project in other field, right?
Yes.
Okay. So now is the Q&A section. So anyone have the question, please you can raise up your hands, or you can post your message on your chat box. Oke, ya silakan kalau ada yang mau bertanya, ada yang mau ditanyakan, boleh ditulis pertanyaannya atau langsung raise hand, boleh dalam bahasa Indonesia atau dalam bahasa Inggris ya. Atau kalau dalam bahasa Mandarin juga boleh juga kalau ada yang bisa ya, silakan. Okay.
Okay. There is someone asked that what is the
Okay.
Hasmo use? Yeah.
Yeah. Okay. There's a question from Gali Ganjar Prakoso. The question is, what is the heart thermal used to detect body layer temperature and how does it work? Okay. Please, Dr. Yeah.
Yeah. I have the Hasmo, but it's no battery now. Can you see that? Okay. Here. There is a sensor of the wearable device. So the sensor is similar like the infrared ear temp thermometer. So we input the sensor into the wearable devices. So it can be used to measure the wrist surface temperature. And the major frequency of the wearable device is every 10 seconds. But like I have said before, the variation of the skin temperature is quite different from our core temperature. So that's why we need to develop the AI algorithm to early detect the abnormal variation of the skin temperature. So I hope I answer your question.
Okay, thank you, Dr. Ye. Maybe could you explain a little bit more about maybe they're asking how to get the data or like okay, when we use the device and then it can detect the body temperature, right? And
Yes.
how does it I mean, because the main issue in this device is about the continuous monitoring. Maybe yeah, I know you have already explained in your PPT. Maybe could
Yeah.
you make can you summarize and then what has been done by this device so therefore we can get
Oh,
the
okay.
data and is it about the real time or something that and then afterward we can there will be a notification as an alert something.
You mean how the data transmit
Yeah, how they
or
can
how to
transmit and
record?
detect.
Yeah.
Yes, correct.
The physical indicator, the data from, I mean, the data of the body temperature and the heart rate will record in these wearable devices. And once we have the gateway, I mean the one devices, and they can connect by Bluetooth, and the data will be transmitted to the gateway, and the gateway can be transmitted to upload to the cloud by internet. Therefore, we can detect, we can monitor the remote monitoring the patient's data and patient's conditions remote after the cloud-based by using cloud-based platform. Yeah. And,
Okay.
and yeah, I have some experience about the development of the wearable devices because for nursing students, I think there's a tough process to thinking about how to develop a wearable devices. So at the beginning, I tried to use the wearable devices to measure the wrist temperature and validate with the current medical thermometers. So I use the infrared thermometers to measure the temperature here and to see the relationship, the correlation between the temperature measured by the wearable device and the temperature measured by other infrared thermometers. Yeah.
Okay. Thank you, Dr. Yeah. Yeah, I think Gali cukup jelas. Are you there, Gali?
Iya,
Yeah, I
jelas.
think
Thank you for
jelas ya. Okay. Yeah. Okay, any other question? Silakan, kamu bertanya lagi, boleh dalam bahasa Indonesia boleh ya, silakan. Yeah. Okay, well, while we're waiting for the question, so
Yeah.
Dr. Ye,
Yes.
so for the information for the participant now, Dr. Ye and I have conducting how say the international collaboration project
Yes.
we have started, and we have already collect about 40 participants, and about within 1 month, among the healthcare providers in some hospital. Yeah, we implement, as we use the same device as Dr. Ye's show in the screen. And yeah, we hope that in the future, the system will be implemented. I mean, like if the AI algorithm is fit enough, I mean, if the and also the device is show the good sensitivity, maybe we
Yes.
can have another project to measure. To do this project among the elderly, because right now we just conducted among the healthcare provider. Yeah.
Iqbal, I have a question for you.
Yeah, sure. Well, why you raise the question?
Yeah, because I'm curious about that. What's your experience to use the wearable devices in your country? I think there are different difficulties facing in different country context. Can you share with us about
Okay, sure.
using? Yeah.
Yeah, in my experience, because before I distribute the device to the participant, before I start data collection, I'm trying it by myself. I mean, I use the wearable device, and then in my experience, because sometimes it's not our habit that we keep use our device in 24 hours, right? Usually we just wear the device when we are go out. Even when we are at home, we just put it off, right? And also when I ask the participant in the hospital, we just ask them to wear the device during their duty, right? During their working hours, even though some of them like um, they forgot if they want to do something that they think that wearing the device will be disturbed. I mean, will disturb their work, so they will put it off. So that's why when we retrieve the data, we have missed some data, right? So yeah, that's the obstacle. I mean, yeah, I think in the future, because I think it's important to make sure the participants uh, do it I mean, in consistent way, right? So that's one of the obstacle that we found.
Yeah, there is also the challenge. I think that's a main challenge for every wearable devices. Once the people did not have the habit to wear any devices on the hand or on the any part of body, they don't used to use the wearable devices continuously. There, so for AIoT, I mean Internet of Things, not only divided as wearable devices. There are many devices developed not to wear and can monitor the patient's conditions, like a camera, or like for me, I use the home energy. When we use the light or the energy in homes, so we can know the daily life patterns of the elderly. So I started to work with different interdisciplinary experts to thinking about like how we use different kinds of IoT data to answer our medical problems or medical care issues. Yeah.
Yeah, I think yeah, I have also received some message, some comment from my college, and also from my teachers. She said that in Indonesia, maybe our one of our habit, like we just wear the device just like to not for the function, but only for the style, okay. I just wear it to to make me looks okay, to make me looks great, to make me looks
Good.
stylish, right? Yeah, bu.
Yeah.
Can I say
That's what.
something?
Yeah, please
Yeah.
go ahead. Yeah, yeah, bu.
Okay. Oh, thank you. It was so, what is a wonderful presentation, and we can learn a lot actually from you and your colleague in CKU. And then student also can learn how to use AE, artificial intelligence, in our work as a nurse, but also not only we can learn also that what is in terms of that, but also we can learn how this project can involve all the healthcare workers. So interprofessional collaborative practice can be also enhanced by developing this kind of tools. Remember, like you said in the beginning, I really love your what is your introduction when you said it, because I'm so worried about when we talk about artificial intelligence. We just thinking and criticize about nurse cannot use that quite a lot, because we use ourselves, our body, our present, as a tools, as a tools, as a care itself to the patient. But in the beginning, you have already mentioned that this what is the artificial intelligence is only a tools that can like make your work easier, make you can predict what the patient will have in the future. That's the best thing of the this what is project. Actually, regarding this kind of tools, I mean the detection of heart rate, or maybe sleep pattern, or what is body temperature. It's already, we have some of us maybe more like a majority of the wealthy people in Indonesia will have that, those kind of thing. But what we have learned from you, from your project, is we can predict, we can project, well, yeah, predict what will the patient have in the next, I mean, within the 20 minutes, or with 24 hours, within a week, for example. So we can like in the era of COVID-19, we can predict that this patient will develop the what is a high temperature. So we have to be careful what nurse and what other healthcare professionals should do to what is to minimize the impact on the patient, and also to minimize the transmission between the all the what is interacting actors in the patient care. So this it's not new actually, it's common things. But what good thing is we can we can use this kind of thing as a prediction tools to make our work much more cautious and easier. Thank you very much for your insight, and then we can learn more from you. Maybe our student can learn more from you later in the future project. Thank you very much.
Thank you.
Yeah,
Thank you.
thank you, Bu Hartia. Dr. Hartia is my teachers. You know, when I was a student, and she already became a teacher, she's like my mother. She's
Now
also,
Iqbal is much clever than me.
no, no, no,
I'm a successful lecturer then.
No. And also Dr. Hartia is also her expertise also in geriatric and in gerontology.
Yeah.
So Dr. Ye, maybe in the future we can do a collaborating project about something related with this in the future, especially in the geriatric population, in the elderly population. And yes, it's true, really true that the device has been established. I mean, we have already, I mean, the device has been used by many people in the world, not only in Indonesia, but the most important thing is how we use it, and the algorithm about how we interpret, how we can use this device to make it, to detect, to prevent the further complication, because by using this device, we can give an alert system, an alert or early warning to the patient, cautious, and so that's why we can do something in the golden period. So therefore, we can prevent some complication in the future.
Yes.
Yeah, thank you, thank you. Yeah, I want to highlight that the role of nurse. Yeah, because you can see that different technology and different wearable device has been developed there, but I don't know whether you have the experience of that. I have the experience because when we get the devices or technology, I don't know how to use in the practical situation. So that's why we need nurse in the interdisciplinary team to talk about the real case, talk about the real situation scenario for the IT man, for the engineer, and then that to thinking about how to use the technology in the real practice. So who can find the real unmet needs? That's why the nurse is so important. The role of the nurse. Yeah. So thank you for the feedback.
Yeah. Yes, correct. So
There's
we are
one more
surprised
question,
the
Iqbal,
nurse,
in the
right?
chat room, please.
Okay,
Yeah.
let me see.
Yeah.
Okay, it's from Farida Afifa. Hello, Miss Chun-Yin. Thank you for sharing the knowledge. I have a question. Do the elderly have difficulty using AIoT based tools? Considering the ability of the elderly, especially in Indonesia, they tend to have difficulty using technology. Yeah. So yeah, thank you. So the Farida asking about the feasibility by implementing um, I have to say AIoT based tools among the elderly, because as we know, I think not only in Indonesia, in many countries also, but especially Indonesia, maybe if they're getting old, like they're lazy to learn how to use some kind of to adapt with the technology. So how we deal with these things? Yeah, please, Dr. Yeah.
Yeah, that's a challenge because for the elderly, they don't have the hub, they don't use the wearable devices or the technology. So you have to simplify the devices or simplify the use usage process. For example, in a long-term care facilities, we let the elderly just wear the wearable device. They don't need to set up some icon or something. They just wear the wearable device. But yes, I think the most important thing is that you have to consider uh, the the habit and the daily life of the elderly. If they don't have the habit or they don't use to uh, wear the wearable devices, you can make it benefit for him for her. For example, there is an NFC function in the wearable devices. So in a long-term for long-term care facilities, the elderly may use these wearable devices to open the door or to buy something in the future. So they will use the wearable devices. So that's one direction we want to serve in the future. But as we said, there are many different kinds of wearable devices or devices. IoT devices have been developed. So how we use the IoT systems in the long-term care facilities, maybe we can start to consider non-wearable like a camera or like non-invasive devices. So for the elderly, they just live as usual, but we still have the live data from them, and we still can analyze the data and to answer some to provide individual intervention for them. Yeah. So I don't know whether I answered
Oh,
your
sorry.
question or not. Yes.
Yeah, sorry. I just I forgot to unmute myself.
Okay.
Yeah. Okay. Thank you, Doctor. Yeah. I think according to your explanation, that the point is, as long as we can give a benefit to them, so perhaps they will. I mean, they will follow. I mean, the protocol, right? Or yeah, because there's a challenge when we're going to do a project and we use the elderly as the participants. Some kind of when we want to implement the protocol, not all of them will follow the protocol. Maybe some of them, like, they just withdraw in the middle of the process. So maybe it's very important to, the first is, as according to Dr. explanation, as we have to simplify the device and the protocol, maybe, and in the second is, maybe we can, as long as we can give, we can tell them that they will gain a good benefit from this. So I think probably they will follow the protocol. Is it? Ya, apa yang sudah menjawab, Farida?
Yes, thank you for the answer, Miss.
Yeah, okay. Any other question?
Yeah, I see that there is another question in the chat
Oh,
room.
really? Okay. 1 second.
Shall we use the device for a whole day to know when the fever comes? Does it affect to comfort level?
I'm so sorry. Okay, yeah, please. He can read by himself, because
yeah, I can read it by myself.
I was lost my connection, so therefore I restart and I rejoined the Zoom, so I lost the chat box.
Okay. So,
please, Dr. Yeah.
Yeah. We can already for different patient. Okay. I have to say that the AI algorithm is individualized because for me, my baseline temperature may not similar with IGBOS. So the AI algorithm will focus on the individual variation for lab users. So should we use the device for a whole day? I think it's not. We cannot force the user to use the wearable device for a whole day. But once you wear the device for a long period, we can make the AI algorithm more individualized for you. Yeah, because we get a lot of data from your own data, so we can modify the AI algorithm for the individual to be the individualized models. And does it affect to the comfort level, especially to the elderly? Yes, maybe, because for the wearable device, sometimes when people had a sweat or wash their hands, they may feel some sticky from these wearable devices. So that's why we need to continuously discuss with the hardware company and to reconsider different kinds of wearable device. So as I shown in the previous slides, I have said that we have cooperate with different we have developed and cooperate with different hardware company to have different wearable devices. For example, some of the devices have approved by the FDA, and we can let FDA, which means the approval to the medical devices. So we can use a wearable device to make the users feel more comfortable to use. Yeah.
Okay.
Yeah.
Thank you, Dr. Ye. So yeah, that's the answer for Gilang, right? Yeah, I think we don't ask them to wear the device for the whole day, because the device will record the data every, how long?
10 seconds.
10 seconds, right?
Yes.
every 10 seconds. So every 10 seconds, we will get the data. So you can imagine, even in 1 minute, we will retrieve about 6 data, right?
Yeah.
Yeah, 6 data. So in 10 minutes, we will get 60 data. So for 1 hour and 2 hours, we will have a lot of data. So yeah, but the problem is sometimes when they put off the device like for a couple of hours, and then at that time, for example, they have the increasing of the body temperature, so we cannot detect it, right?
Yeah, but that's the issue we discussed with Google this morning, because we know that many people don't wear the continuous wear the wearable devices. So we try to improve our technology by, when we have missing data, can we still know the abnormal prediction? We still can use. So we cooperate with Google to solve these issues. So yeah, we are now working on that.
Okay, nice. So even we miss the data, we can do the analysis by seeing the maybe like the trend, right?
Yeah.
Yeah. Okay.
At a variation before or at a later variation, so we can still detect the abnormal conditions of patients.
Okay. Yeah, I think in my opinion, it's like we do the quick count, right? So when we have the election of the president, when even before we get the real data, we can predict the result by do the quick count, because we measure, I mean, we can predict by seeing the sample, and then we see the trend from the every side. Yeah, it's like that, right? So
yeah. So we still keep going, keep working on that. Yeah.
So that one is the Google that you told me before that you're going to collaborate with us.
Yeah. In the Google project, we're working on 2 kinds of problems. The first one to early detect people at risk for poor prognosis. And the second one is a technology challenge for the missing data, because we have found that many people cannot use the wearable device for 24 hours a day. So can we still use that kind of data to answer the practical issues? That's why we cooperate with the technology expert in Google.
Okay, nice.
Yeah.
Okay, any other question? Okay, yeah, I think there's another question. Oh no, okay. Ya, jangan lupa diisi absen ya. Please fill the attendance list for the students in link before. Jangan lupa diisi untuk absen ya. Okay, well, yeah, someone speaking.
Yeah, this is me, Gilang.
Okay, Gilang, please, you can raise up your hands directly, please.
Oh, sorry about that. Yeah, I need to clarify something actually. Can I?
Yeah, please.
Okay, basically the function of the device is just the same like a thermometer, right? But in a high-tech way. So interesting. So is it like that, or I've got wrong? So basically the function of the device is just the same with a thermometer, but in a high-tech way.
Okay, I think you missed some information. Okay, let's okay, Dr. Ye. Yeah, are you there? Yeah. One of the student, Gilang, he asked, he just want to clarify about the device. So basically the device is the function of the device is similar like the classical thermometer. So what's the difference? Yeah, can you explain it more?
Yeah, it's similar, but we cannot continuously use the thermometer to continuously monitor the body temperature, right? And another different part is that we use the wearable device in the skin for measuring skin temperature. So skin temperature is mediator plays a key role in thermoregulation. Before we had a fever, the skin temperature will increase. So we want to early detect the fever. So once we cannot use the usual thermometer to detect the fever, to early detect fever, we only can use it when we had a fever. That's why we use the wearable devices and with the AI algorithm to early detect fever and early detect abnormal conditions.
Yeah. Okay, is it clear, Gilang?
Okay. Thank you very much, Mr.
Yeah. So
That's the question.
basically, if you have the device, like the function is like similar with the thermometer. However, this device can measure the temperature continuously, right? So and then it will send the data into the cloud, and then we will retrieve the data from the cloud, and we can know when someone's going to get fever. Before they get fever, we can know.
Become worse.
When the fever, we can know before the fever become worse, because we have already the trend, the variation of the increasing body temperature.
Yes.
And also about the algorithm, there will be an algorithm that will calculate how risky someone to get fever, right?
Yes.
Yeah, I think that's all. Yeah, but I think it's a good question, Gilang. Thank you.
Yeah, thank you for the question.
Any other question? Ya, please. Ya, silakan kalau yang mau nanya langsung ya, silakan. Ya. No? Okay.
There is no question. I have some more.
Yeah, please go.
For the student, I think.
Okay, please.
Because this student, I mean, this program, or is a part of the gerontologic nursing subject, right?
Yes, correct.
And maybe in your, I mean, Iqbal and Chitra, in our assignment, part of the assignment, maybe, or maybe in the family, nursing subject, there is an assignment of the about the innovation kind of project, but it's not in the real project, but the innovation, the idea. So from you, Dr. Ye, that a student can also learn, I mean, think critically for older patient, because you so far your tools or tools, artificial intelligence tools or computer-based tools is maybe, I'm not sure, maybe you also have some other features, some beside the measuring the body temperature. For me, maybe our student can also think about whether for older people, it also can be broadened. The function can be broadened into, for example, detect the blood glucose level, because the monitoring of blood glucose level also has much developed nowadays. You don't have to draw some blood, but maybe just what's from the skin surface, you can also measure the blood glucose level. So diabetes mellitus, for example, hyperglycemia or hypoglycemia, for the patient with type 1 diabetes mellitus can gain much more benefit from this kind of tools, this kind of computer based tools. So maybe the student can also think about what is some more, what is innovation from your thought, from your project, maybe in the future, to think about the application of this tools into the gerontologic the older people. I think. Thank you, Iqbal.
Yeah. Okay. Thank you, Bu Hartia. Yeah. Well, Dr. Yeah. It's kind of Dr. Hartia is suggesting that is there any possibility like we can invite another teacher or another expert who works on the geriatric fields, but like focus on another issue like the blood glucose for about the diabetes or yeah, because yeah, as Dr. Hatia says that in geriatric we are facing many problems, not only about the fever, also how about the another biomarker. Oh, yeah,
Sure,
do
of
you have
course, of
any
course.
idea? Yeah.
Yeah. Yeah, of course, we are looking forward for the cooperation with different experts in different solving different practical issues. For example, the control of the blood sugars or some functional decline in the elderly. I mean, for
Yeah.
the elderly, the main issue may be the functional decline and how to increase improvement their quality of life. So there are so many things we need to address and to fast, and we are open mind and looking forward for the cooperation.
Okay, thank you. So yeah, there will be another project, right? But right now, you and your team just focus on the continuous body temperature, right? Monitoring.
Not really. We focus on the AIoT solutions. So
Okay.
once you have any novel idea or you want to, we can help you to address the issues, not only for the temperature, but also for other physiological biomarkers. Because when we use the IoT to to retrieve the data, we can do the AI algorithm and to provide the system service for you.
Okay. Thank you. Thank you so much, Dr. Ye.
Yeah.
Yeah. So it's only the beginning, right?
Yeah, for me, for us, for the nursing period. So we are defining the future of nursing, looking forward to have further cooperation.
Yeah.
Thank you.
And one more thing is even we use many kind of technology, don't forget the role of the nurse is still very important.
Yes.
Because we control the device, the using of the device, and as you mentioned that as a nurse we know more about the condition of the patient, right? Compared to other profession, because we always I mean 24 hours the nurse always there, right? We work in so every time I mean when the patient admit to the hospital, they get hospitalized, they always meet the nurse. The nurse is always there. So that's why the nurse, I think the nurse is the one that know very detailed about the patient compared to other professions. So that's why we have to be so proud as for being as a nurse, right?
Yeah. Thank you. Yeah.
Okay, everyone. I think yeah, the time is almost done. We now it's 2:35. Is there any closing statement from you, Dr. Ye?
No, thank you.
No?
Thank you for
Okay,
the
yeah.
opportunity here. Yeah.
Yeah. Okay. Well, everyone, thank you. This Dr. Ye, thank you very much for your speech.
Thank you.
It's
Thank you very
very
much.
it's very important to us. From your speech, we have learned a lot how to use the technology to give a good service to the patient in terms of patient safety, in terms of to maintain the high quality of nursing care, right?
Yeah.
So 谢谢你们. So yeah, we
谢谢.
hope we can invite you.
谢谢
We can hope.
Thank you.
谢谢你的讲究用全保持安关系。
Wow.
厉害. So good.
Sumelo. Oh,
You're welcome.
Okay. Yes. Thank you, Dr. Ye. So before we end, can we have a photo session? Yeah, everyone can help us to take a picture because I'm not using my computer. I'm using the tablet, so I cannot see I cannot see everyone here.
Mahasiswa aja.
Ya, Bu. Oke, bila boleh tolong ada mahasiswa tolong fotokan, screenshotkan. Siapa ya? KMK-nya siapa nih?
Ada yang boleh bisa dibantu? Maaf ini saya berdua. Boleh ditolong dibantu?
Boleh tolong
Siapa?
dibantu?
Page 1, are you ready?
Oh, oke. Makasih, Gil.
Okay.
Oke.
Page 1, 1, 2, 3. There is 9 pages.
Wow.
They are
9
not
pages.
Yes, yes.
And we don't know which one ours.
Yeah.
Yeah.
Page 2. Page 3.
Still page 3.
Page 4.
Mahasiswa ini kebiasaan deh. Ini difoto, dibuka dong semuanya.
Page
Gimana
4,
sih?
Penisha.
Masa fotonya nanti nomor mahasiswa semua? Terlalu.
Page 5. Page 6.
Okay, 3 more.
I
Okay,
think it's
7.
only page until page 6 because the other one is not video. You know.
Ya.
Yeah.
Ya.
Okay,
Oh.
yeah.
Nah,
Okay, thank you.
Thank you.
only to be.
Thank you, Chun-Yin. Okay, please
Thank you,
send
thank
our
you.
regards to
Thank
all
you.
colleagues there.
Bye-bye.
Okay, 谢谢见。
不客气。
谢谢你的掌握。
Okay, yeah, yeah. Later I will contact you again. Ya, silakan. Jangan lupa di absen ya, diisi absennya teman-teman mahasiswa semua. Mangga Bu Citra, kembalikan ke Bu Citra.
Gilang?
Ya.